Welcome to NDF Speaker Series. My name is Sepideh Tabbian, and I've been involved with HIBM since 1982 with different organizations. And then when NDF started, I joined NDF, and I've been on board for past few years. My background is in real estate, and I have hobbies to be board member in different organizations and helping out. And NDF is one of my top priority, and it's helping me to have a good understanding of the disease and the problem and situations that the patients are involved. And going forward, I like to participate and help in however ways I can. Today, we have an excellent speaker, Dr. Sepideh Tabbian, who's a very good friend of mine, and I know her for over 15 years, and actually she introduced me to NDF. So Dr. Sepideh's background is as such. She earned her bachelor degree from University of California, Los Angeles, her medical degree from University of Health Sciences, and she subsequently trained in family medicine at the Western University of Southern California. For over a 10 years period, she served as NDF board member, and she has been a GNEM patient for the past 25 years. I also happen to know Sepideh over the past 15 years. Her strength and tenacity have been apparent in how she deals with her life challenges. Now she is determined to teach her GNEM community and others what she has learned through her personal journey over the past 30 years. Just a quick reminder that at the end of her lecture, we have set aside time for questions and answers. Please type your questions in the box down below. Sepideh, go ahead.
Thank you, David, for your lovely introduction. Thank you, everybody, for tuning in today. We're going to talk about mindful living and its alternative approach to living a fulfilling life with GNEM. So what I want to talk about is what most of people deal with in modern society, which is chronic level of stress. And more important than that is fight or flight response. So basically in modern society, we all dealing with a lot of stress. And when the flight or fight response is triggered, then you get a release of hormones, and which they prompting us either to stay or fight or flee. When you going through fight or flight, you mobilize a lot of energy to prepare you for danger that is presented in your outside world. So as a result, the stress hormones are released in your blood, and the changes that because of that, your heart rate goes up, your respiratory goes up, and your blood flow goes from your basically like GI system or stomach, everything else, to your extremities, to your arms and legs. So this is preparing you to run or hide. And at this point, when you are in this response, when you are stressed out, you cannot obviously relax or think clearly or digest your food. So in old ages, in cavemen, basically, there was a danger for them. It was like a tiger was running, chasing after them in the jungle. So they would just, the fight or flight response would be triggered, and they would just run away until they reach a place of safety. And all these hormones, the stress hormones that were in their bodies were triggering all these hormones. And then after the danger was over, like 10, 15 minutes or whatever, the whole body goes back to the homeostasis, which is a normal level. So your respiratory response and respiratory rate and heart rate would go down, and you relax, and the blood flow goes back to everywhere else. But in the modern society, it's not a tiger chasing us. It's your boss. It's stuck in traffic. It's fighting with your spouse. All these things create a lot of stress. And unfortunately, most of us deal with stress for a long time, for chronic time, for like years and years. And what happens is your body is never goes back to the homeostasis because you're already, there's like so many stress going on. And the problem with that is when you live in the chronic level of stress, if it goes untreated, it causes various health issues, which we're going to talk about a little bit later on. So also in our modern society, we see increasing chronic health issues with some being terminal. A lot of cancer is going on right now, people dealing with that. Even if it's not fatal, after a while, it would cause a lot of psychological issues like anxiety and depression. So like people who have chronic pain obviously become depressed or anxious. And most people seek out help in traditional ways. They go to see their doctors, they start taking pills. But however, in this talk, I want to introduce you to concepts that it's not medication, and it's alternative ways to approach the deal with stress, chronic stress. And this is also very important for people who are affected with GNEM, because obviously because of the disability that they deal with every day, it definitely causes psychological issues, a lot of stress, chronic stress, depression, anxiety. And although we are waiting for research to show us some answers, but we can delve into alternative modalities at this point to help us live a better and healthier life. And a lot of people suffer, including GNEM patients, when we think about past and like think about the negative experiences that we've had in the past, or we worry about our future. We don't know where it stands, especially if you have like chronic health issues. You don't know where your body is going to be like 10 years down the line. And that creates a lot of stress and a lot of anxiety for people with disability and for other people as well. The best place to be at is present time, which is truly a gift. In order, like, I want to give you an example, like an artist painting on a canvas. At the time that he or she is painting, she is completely in present time, completely present. That person is not thinking about the bad experience in the past, or that person is not worried about future, and that's being present. One trick for you to check if you're present or not, when you are present, you're basically in tune, in touch with your senses. So if you want to try it, you can just see if you're tasting anything, what are you hearing, what you're seeing, what you're feeling. So when you are focusing on your senses, you become more present. And also in this lecture, I'm going to talk about techniques that you can calm yourself down without taking medications. The two that I want to talk about today, there are breathing techniques that I want to show you, and also meditation. So the proper breathing techniques are extremely crucial for your health. Many people fail to perform mindful breathing. We just breathe, and then worse than that is when you're stressed out, you tend to breathe on your upper chest and very shallow, something like that. And that doesn't help you with anything. I want to tell you, I'm going to talk about 5 breathing techniques. I also have added the links to the videos of showing these breathing techniques. So when this video comes out, you can just watch it. So if you don't get it today, don't worry, you can watch the video later on. So the first one is box breathing. Box breathing is you close your eyes, you sit down, comfortable place, close your eyes, and you you inhale through your nose for the count of 4. You hold your breath for the count of 4. Then you exhale for the count of 4. This is all through your nose. And then you hold for a count of 4. So I'm going to demonstrate it here. You can do it with me at home. So inhale 1, 2, 3, 4, hold, 1, 2, 3, 4, exhale, 1, 2, 3, 4, and hold, 1, 2, 3, 4. I'm going to do it one more time. You guys can do it with me at home. Inhale through your nose, 1, 2, 3, 4, hold, 1, 2, 3, 4, exhale, 1, 2, 3, 4, and hold, 1, 2, 3, 4. So this breathing, all these breathing techniques that I'm going to talk about, it's going to help you with like stress, anxiety, not feeling down. So these really going to help you with doing that. The best is to do it sets of 10 in the morning and in evening. So twice a day is really recommended. But do it as many, if you can do it twice a day, just do it once a day. That's fine, as long as you're doing it every day. The second technique is called belly breathing. If you notice the kids, the babies, when they're born, if you look at them, they only breathe through their belly. And that's really important way of breathing, because you are not using your upper chest area. And this way, when you're using belly breathing, it definitely relaxes you. So it's hard to demonstrate right now. You don't see me, but you can lay down on your back or sitting, whichever you're comfortable with. You can put your hand on your belly and kind of inhale and expand your belly at that time. It doesn't have to be forceful. You breathe through your nose. So you expand your belly, and then very slowly you release the air and you kind of contract your belly muscles. And you can exhale through your mouth or nose, it doesn't matter. So you repeat this exercise as well, like 10 sets in the morning and then in evening. If you keep practicing these techniques, as sometimes you just notice that's how you breathe all the time. You don't even have to remind yourself. And this breathing technique also helps a lot with anxiety and stress. The third one is called alternate nostril breathing. This is very common in India, and people do yoga. This might be a little bit difficult because you're using your fingers for GNEM patients, but just do as much as you can, and you can get help from somebody else. So for this, you use your thumb and your ring finger, but as I said, if you have difficulty, you can use any fingers you can. So with your thumb, you press your right nostril and you inhale through your nose, through your left nostril. Okay, then you let go of your right nostril so you don't hold it anymore, and you close your left nostril. And then you exhale through your right nostril. So now that you exhale, you're holding your left nostril, you inhale back through your right nostril. Now you hold your right nostril, you let go of your left nostril, and you exhale through your left nostril. This might be a little bit confusing, but once you watch the video, it becomes more apparent what to do. So the whole thing is you hold one nostril, you breathe through the other nostril, inhale. For exhale, you switch your fingers. You hold the nostril that you did inhalation through, and you exhale through your other nostril. The same nostril that you exhale through, you inhale back the air up the same nostril, and then now you close your right nostril and you exhale through the other alternate nostril. This exercise is excellent for relaxation, and if you're dealing with some sort of stress, and really helps you. And it's really recommended to do it before meditation. So if you're confused about it, you can watch the video later on, and it demonstrates it slowly so you can look at it. Number 4 is lion's breath. This is when you want to look at a little bit of boost. It could be immunity boost. It could be just like energy boost. And also I've heard that this helps also when you have sore throat. So you look up with your eyes, you stick your tongue out, and you exhale forcefully through your mouth. As you're exhaling, you bring your head down and you try to touch your chin to your chest. So you open your eyes, look up, stick your tongue out, and it goes like that. One more time, open your eyes, look up, stick your tongue out, and forcefully through your mouth, you exhale as you bring your head down. If you cough during this breathing, it's fine. And also, this is also recommended to do like 5 to 10 in the morning and in evening. You might feel a little bit dizzy afterwards. That's normal. Once you get used to it, you don't have any problem whatsoever. The last one is actually, it's one of the very powerful breathing techniques. It's very easy, and this is also helps you with stress and anxiety and so on and so forth. So it's 4-7-8. So you inhale through your nose for count of 4, you hold your breath for count of 7, and you exhale forcefully through your mouth with a count of 8. So it goes like that. Inhale, 1, 2, 3, 4. Hold, 1, 2, 3, 4, 5, 6, 7, and you exhale the count of 8 like this. So if you want to join me, I'm going to count. You guys do it with me. So inhale through your nose, count of 4. 1, 2, 3, 4. Hold your breath, count of 7. 1, 2, 3, 4, 5, 6, 7, and exhale through your mouth forcefully, audible. 1, 2, 3, 4, 5, 6, 7, 8. So you exhale like this. This is also recommended 10 sets twice a day, but as I said, you start them with maybe 5 in the morning, and then later on you can increase it. This is an excellent way to boost up your energy. Like you wake up in the morning, you feel low in energy for any reasons. Maybe you're suffering from pain, maybe you're suffering from anything like stress. So you can start doing these breathing techniques. You can start with the one that it's easier for you, and you can add the other techniques. And you can do it like when you're stuck in traffic and you're really stressed out. You can do this, and it's really easy. You don't need any devices. It doesn't cost you anything, and it's one of the best way to deal with the daily stress that you go through. So as I said it before, when we are in the state of panic and anxiety, we tend to have shallow breathing. Exercising these breathing techniques help us to stimulate parasympathetic nervous system, which helps us to relax our mind and body. So now I want to go into talking to you about meditation. Last year, during my talk, I briefly talked about meditation. I just want to tell you what the word meditation means. It means to become familiar with. And that means an individual becomes familiar with their thoughts, behaviors, and emotions and old self. And then there's a chance to retire that old self and become observant of one's old patterns. So meditation is practiced in many cultures and countries, and it's a process of redirecting your thoughts to calm your mind. Many years ago, it used to only be practiced in certain countries, such as India, China, but then thank goodness, to a lot of people who brought it to Western society and other places. Now we all have access to many different meditations online, and we can take a lot of classes. It has actually been practiced in Southeast Asia for over 2,600 years. So it was an experiential path that inspired generations of practitioners to sit in mindful awareness and breathe their ways to lasting peace. So meditation actually research, numeric research that shows a lot of health benefits, including reduction of your blood pressure, managing your pain, reduction of anxiety and stress, improvement of your sleep, improvement of your attention span. Basically, it makes you become very patient, and in basically increasing overall emotional health. So as you see, meditation has a lot of benefits. It's really easy. We can do it without using any devices, and we can do it anywhere we are. It doesn't cost us anything. This is also mentioned last year. It's the key is to practice it constantly, being persistent. If you practice it 2-3 days and then don't do it for a week and come back to it, it just doesn't have the same effect. And you kind of lose the drive to do it, and you just, it doesn't give you the effect you want. So it's really important to do it persistent, maybe 5 minutes a day, maybe 2 minutes a day. And a lot of people might say, well, we don't have time. You can set aside 5 minutes. I'm sure you can. And then also a lot for the beginners, the thought of sitting in the silence in a place, it might be overwhelming, but over time, I promise you, you'll be able to do it. You learn how to sit with your thoughts. Unfortunately, modern day society, we are so distracted with everything, with life, with doing things, running errands, going to work, traffic, driving, kids. And it's hard for us to sit in a quiet with ourselves, with no phone, no distraction, no TV. And you can practice it to see. In the beginning, it's very strange, and you're dealing with so much thoughts in your head that it's just very hard. But over time, the thoughts become, the chatter in your head becomes less and less and less. You can do longer meditation, and you feel so rejuvenated afterwards. You feel so relaxed afterwards that you just you love to do it. As I said before, also meditation is best. It's like breathing techniques, practice twice a daily, morning and evening. There are many different techniques. There's some that they recommend 20 minutes in the morning and evening. However, there's some meditation that is you can listen to it. It's guided meditations, and those are sometimes longer. So if you're doing those meditations, you don't need to time yourself for 20 minutes. You just do it the whole time. Some of them are 1 hour. And actually, if you start doing it more, like if you do a 1 hour meditation, it helps you a lot with calming your mind than just 5 minutes. But for the beginners, I would just recommend doing 5 minutes. And there are different type of meditations, some using mantra and some don't. And the ones that are guided meditation, they don't give you mantra. And any type of meditation is good. I don't want you to be picky. Just pick whatever that speaks to you, and then move on. So what is mantra? Mantra is used in some meditation, including transcendental meditation, TM for short. It is basically a meaningless word. And the reason for that is because if you repeat a word that has a meaning in your head, in your mind, there is a picture associated with that word. And you'll see that picture, like let's say color red. You see the color red in your mind. However, mantra is a word that doesn't have meaning. So once you repeat it in your head, your mind cannot put a picture with that word. So eventually, when there is no picture, no meaning to that word, your brain starts to relax, your mind starts to relax eventually. So as you're practicing, so it helps you to relax your mind, and helps you to go in a state of trance. State of trance is a state that you have no body, no name, it's just your pure consciousness. And that's what we want to approach with meditation. And as I said, it's more than relaxation. Meditation is a pathway to tap into your subconscious mind. So our mind is divided to conscious and subconscious. 5% of our mind is subconscious, which we make decision, we are aware of what's going on, and 95% of our mind is subconscious mind. The subconscious mind starts developing in when you're born till age 6. So basically, every word, every message you get from your parents, your environment, you absorb it like a sponge at the young age, and that becomes part of your subconscious mind. Subconscious mind is like one example I can give you. Like in the beginning, when you start to learn to drive, you have to be mindful of everything. You have to check everything. You have to make sure you're doing everything correct. So you're constantly thinking with your conscious mind. But after a while, when you start driving, you don't even know how you got from one place to the other. It's because this subconscious mind took over. So you don't even think. You're just doing it automatically. So a lot of things we do in our lives is from our subconscious mind. It's so automatic, we don't even think about it. It's a lot of words coming from if you've noticed, sometimes you repeat something that you've heard from your parents, you repeat the same thing because it's your subconscious mind. And with meditation, you can tap into the subconscious mind, which is very interesting part of meditation. Also, meditation can take us from Newtonian physics to quantum physics or quantum field. I mean, I don't have a lot of time to talk about Newtonian physics to quantum physics, but Newtonian physics, there is like from point A to point B, if you want to go, you basically pass time. But in quantum physics, there is no time, it's only consciousness. And that's when you get into that field, that's when you can tap into your healing, into your body, into your health. It's a very exciting place to be. How do we get there? Through meditation. So for me to explain to you how meditation works, I have to talk about our brain wavelengths. And that's meditation changes our brain wavelengths. So what is brain wavelengths? In our human brain, we have 5 different wavelengths, which are called beta, alpha, theta, delta, and finally gamma waves. These brain waves change based on our activity and our feelings. So let me talk about beta waves. Beta waves is a state of awareness and wakefulness. Your senses are very active in this state. You gather information from outside through your senses. This happens when you wake up in the morning, when the light hits your eyes. It causes the pineal gland, which is a gland in your brain, to release neurotransmitters called serotonin. So that's how you wake up. The same way at night when there is dark, there's no light, the darkness actually causes this pineal gland to produce melatonin, which helps you to sleep. When the brain is beta, our focus is on outer world, and our awareness is focused on our body, location, and time. I'm going to explain this. During state of high stress and fight or flight, our brain is in high beta brain waves. When I say you focus on body, location, time, imagine a tiger is running after you. So you're worried about where are you, where you're going to get. So location becomes very important to you. You are aware of time. Time is very important. Every minute it's like 1 hour for you. And also your body. You feel your body. You're like stressed out. You're not feeling good. So this is when you are in high beta wave, or when you're in stressful situation. That's where you're focused on, your body, location, time. And our focus is narrowed on the threat or perceived threat. And we focus on objects and what's going on in our surroundings. We cannot focus at that time on our being relaxed, reading newspaper, or doing anything. No, you have to be prepared to run or flight or fight. Now, with meditation, we want to go from beta to alpha and the other wavelengths. So as we go down from beta, our brain becomes more relaxed. Our mind becomes more relaxed. So alpha waves, they produce in our brain when we close our eyes and relax. As a result, we focus more on our on our inner world than our outer world, because when you close your eyes, you just basically, you only have inner world, it's darkness, you can't think about it, you look at outside. And alpha waves usually occur when we are involved in activities such as meditation, daydreaming, practicing mindfulness and relaxation. I mean, I want to give you a tip. If you close your eyes, sometimes it might happen for some people. You see a change in your drop in your head, and that's usually when your brainwave changes. So theta is the next waves, and they represent state of calmness, deep relaxation, and REM sleep, which is called rapid eye movements sleep. During this phase, the brain waves are slowed down. A person might experience inspiration and creativity while in this state. It's also a part of our subconscious mind. So this is how you tap into your subconscious mind. So your body is falling asleep, but your mind is awake. And this state only comes when you practice meditation for a long period of time. This is the best time that you can have control of your body because you are tapping into your subconscious mind. Your mind is living alone, but your brain is active, like your mind is awake. We also experience theta waves in which we are able to assess our inner worlds. So this is, again, you focus on inner worlds. So the only one that you focus on outer world was beta waves. The rest, you focus on your inner world. Okay, so next is delta waves. On the right, I have the picture of brain waves. You can look at it. So you see the frequency is really high in beta, and as you go down, it almost becomes flat because it becomes very relaxed. Your mind is very relaxed. So delta waves get produced when we are in deep restorative sleep. It's involved with our deepest level of relaxation in healing sleep. They reflect the unconscious mind and our ability to relax and let go. So in this frequency, our bodies are healing and growing in the stages of deep non-REM sleep. So this is where we want to get with meditation. It's not going to happen in the beginning, but as you do meditation for a longer period of time, eventually you get to delta. And it doesn't matter, it doesn't mean that you have to meditate for like years and years. Even in the beginning, you can delve into the delta waves. So the last is gamma waves, and they appear to be involved in higher brain activity, which are included in perception and superconsciousness. They are involved with peak concentration and a high level of cognitive functioning. Experienced meditators describe it as pure blessing when they're in this phase. So as you look on the right, gamma waves basically are almost flat. So that means you're really, really deep relaxation state. So that's basically the purpose of doing meditation and breathing techniques is get our mind to the relaxed state. When we are relaxed state, we can think clearly, we can manage our body better, we can manage our lives better, and we can actually get to a point of healing our body. So I want to also give you a meditation at this point. So before doing meditation, you have to prepare the place you're doing meditating. So you have to pick a quiet place. You don't want distraction. You don't want to have your phone with you, any type of distraction, TV, kids, if possible. Outdoors is really better. So you set aside time. It's better to practice at the same time on a daily basis. But if you don't have time, whenever you can, there's some say that the best time to practice meditation, which is hard for a lot of people, is from 1 a.m. to 4 a.m. because that's the time that melatonin is really active in your body, so you can get into the trance state much faster. But obviously, it's not easy for people to do it. You can do it whenever you want. Maybe when you wake up in the morning, before anything else, you can practice it because that's the time that you kind of not fully awake. So it's easier for you to get into the trance state. So Last year I gave meditation with mantra, which was called Om. I was repeating that mantra, but this year I want to talk about focusing on your breath. I want to show you these meditations that you can do on your own, because sometimes you might not have access to your phone or anything to do like the guided meditations. This way you always can do it anywhere you are. So for this meditation, you sit down in a place comfortably. You can also lay down, but I would prefer sitting down, because if you're tired, you're going to fall asleep if you lay down. So it's better to sit up. If you can't, obviously you want to lay down, whatever you're comfortable with. Comfort is first. So preferably a place that is quiet. There's no distraction. You shut off your phone and you close your eyes, and then you start to focusing on your breath. You want to have normal breathing. So maybe in the beginning, you want to take 2 deep breaths. Exhale, and then one more. And exhale. And then you just focus on inhalation in your head and focus on exhalation. So one special for the beginners, once you start doing this, you basically, all these chatters come back to your head. Oh, I'm tired, I'm hungry, this is too long, I can't do this. These are the chatter in your head. Just ignore it, don't get upset, don't fight, just go back to your breathing, focus on your breathing. Again, you might not even know it. You're thinking about, okay, what are you going to do today? What's your schedule in 1 hour? So again, bring yourself back, your awareness back to breathing techniques. I want to give you 3 minutes. I wanted for you guys to practice it with me, but then I want you to start doing this, set aside time. I'm going to do 3 minutes. You can start with 3 minutes and increase it to 5 minutes. And eventually, if you can get to 20 minutes, it's excellent. You can do meditation more than twice a day. You can do it as many times as you want, but minimum they say twice. But you can also, as I said, start with once a day. So, okay, so once you get comfortable in your seat, close your eyes, turn off your phone and anything else that might be a distraction to you, and then start focusing on inhalation. Closing your eyes, inhale and focus on inhalation, and exhale. You can exhale and inhale through your nose only. And I'm going to time you, and when it's end, I'm going to let you know. All right, now bring your consciousness back to your body. Slowly open your eyes. Take a deep breath. I hope you had a good experience with this meditation. If you didn't feel anything, that's fine, that's okay. It's just, I want you to know, even if you're not feeling anything in your body, your mind, the meditation is still working on your body. And it's gradually, you're going to see changes. You're going to see results from it. So now, if you have any question answers, feel free to put it in the box down below, and I'm happy to answer any questions you have.
When you talking about these different states with the beta, alpha, theta, delta, gamma, can you differentiate how I'm going to feel during every one of these?
Well, I mean, it's not as easy because different people have different experiences. Definitely beta is when you're in stress, when you wake up, you're in beta. Beta has 3 stages into it, 3 sections. You can go medium beta when you're a little bit stressed, and when you're in full panic stage, is high beta level. But then as you start meditating, you go through alpha, and as your meditation becomes deeper, you go to the other ones. As you get to like the gamma, delta gamma, you start being awake, relaxed. Your body is sleeping, but your mind is awake, and that's when the healing can happen. You can tap into quantum field, you can tap into your subconscious mind, you can actually, your body starts up-regulating, meaning stimulating the good genes, and it stops the bad genes, the expression of bad genes, down-regulates the bad genes. Sort of, it's a natural way of gene therapy, I would say. So then your genes, when your good genes get activated, they produce hormones, and everything is produced in your body that repairs whatever is going on with your health issue. And also it works on your mental mind and your psychological state, makes you very relaxed. And you get to a point that after doing these meditations for a while, that you might be in a very stressful situation, but you're very calm and you can think clearly what to do in that situation. So instead of losing your patience, instead of like losing it and start screaming and panicking, you're able to be very grounded, very thoughtful, and then you can handle a lot of things much better. And then it doesn't even affect your body at that time. You can, that's the reason for us to do meditation. It's not just for us to relax a little bit, it's actually to tap into our subconscious mind, to tap into our healing, to tap into our feeling great. And this is very special, very important for GNEM patients. While we are waiting for research, we can do these things to change our mind and change our body. When you change your thought, you feel a lot better. You're not worried about future with your body, and you're not like regretting your past. And that's where I want all the patients to get into. It takes time, takes practice, but I don't want you to lose hope or lose patience for this.
You kind of answered the question. There is a question asking, is there a technique to maintain the gamma state?
It's just meditation. So gamma state is, I guess, once you become like advanced meditator, you can go easily tap into gamma state easily, but it's not guaranteed like every time you meditate, you might tap into gamma state. There are scientists that actually done studies of people that doing meditation and seen the gamma state on like brain imaging. The best answer to that question is to just continue doing meditation. You don't want to worry about the outcome, like, am I going to get to gamma? You're just doing what you have to do and it's going to happen. because you feel great when it happens. So you know it's happening because you feel fantastic. And when you do meditation, basically you go into trance state, meaning like you have no body, no name, you don't know where you are, no place, and that's where you're pure consciousness. And that's when you tap into your subconscious mind.
Okay, I also want to respond to that question. I have proposed to NDF a grant for all the HIBM patients that are very interested into gamma state. They can do reading of Dr. Joe Dispenza's books, and I've been reading them myself for past few years, and it's an amazing experience. And in that book, it tells you how you would transform your mind as what they consider old self to a new self. And in that state, you would go meditate and reach that gamma state, which is just like Dr. Sepideh mentioned. If you're not used to meditation, at first it comes very hard, but if you be patient and slowly give yourself time and do the readings, you would understand what the process is and how it works. So whoever is interested, you can contact NDF and we can show you how you can sign up with the books and readings and the process of meditation.
I'm going to speak about this more in depth in Huddle in August for patients to join us. So if you're interested, you definitely join us in Huddle. So I'm going to explain more about that concept that David spoke about. Any other questions?
Can you explain a little bit in the how the brain would shift as we meditate, like more deeply?
So, I mean, this is not a process that you can predict how it happens, but as you tap into like quantum physics, basically by meditation, your brain gradually goes through all these wavelengths from alpha to gamma. There is no, like for everybody's different. So for some people might happen quick. For some people might happen like for 1 hour during a state of meditation would happen. But the point is you should not worry so much about it. You get to that point, you feel so good that you don't care about anything else. And I think the way you can tell that you're in that state is the way you feel. Because you feel super relaxed, you feel like you're out of this world, you feel like you don't know where you are. And then once, like you're gone basically. And then once you come back, you kind of realize, wow, where I was. Like you might see, sometimes I see people from the other side, like people passed away. I see their images. I go different places. So it depends. And it's different for every individual. It's not the same for everybody. So it's not a like clear answer how you get there, but what you have to be mindful of is how you're feeling when you're doing a meditation. And I just also wanted, like, this is for people who've done meditation for a while. It's not just the act of doing meditation, like you want to do meditation to a point like you feel so good afterwards. Because sometimes when you're so distracted, you might do meditation and you're still in the same mindset. You want to do meditation. So when you sit to do meditation and when you get up, it's a two different mindset. Like you're so relaxed and you feel so good. You feel so energetic. And that comes with experience. And that's very important. So the quality of meditation is very important. And that takes practice. With practice, you get to that quality, good quality meditation.
Also, Tara is asking, can you tell us a bit about your experience with your practice?
I've learned meditation, transcendental meditation, age 16, and I did that for a while, which was fantastic. But then I let go of it. So I would do sporadically, like once in a while, or when I was very stressed out. But then for the past year or so too, I've been doing it every day. And the difference I see is day and night. Um, you actually look younger. I mean, at some point I looked at my face and I had less wrinkles, which was really interesting. Your actual meditation also keeps you younger. You have life expectancy is more when you do meditate. For my experience is um, every day is different, but what I'm trying to do is every time I do meditation, it's a good quality meditation. So I just sit and I do it 1 hour long meditation because that gives me enough time for me to tap into the subconscious mind and I relax. And there are good days and bad days. Some days I'm get really deep into it. Sometimes no. Sometimes I don't go too deep, but that's okay. That's part of the experience. And I don't judge it. I don't get angry. I just do it. And the key is to do it every day and not kind of be so attached to the outcome. Just let it be. And eventually the outcome is going to come to you. You're going to feel so different. You feel like a different person. Like things happen and you don't get as mad as before. You feel like, wow, I'm not mad as before. What happened? Or people see changes in you. They say, well, you act different, you feel different, you look good. They see that as you look good. That's part of the changes happens in your life. And your body changes too. So your body becomes vibrant, your body becomes more healthy. It's not just your mind, it also affects your body and your health.
Okay, I have another question from, I hope I pronounced this right, Ashutosh Verma.
Ashtush,
Ashutosh Verma, she's asking how many breathing techniques out of these 5 are recommended to be done on daily basis? All or some of them?
I would say just start with one that resonates with you more. And then you can do two, 1, 2, 3, or what you can do for week one type of breathing techniques and then switch it next week with different type. So you get to practice all the breathing techniques. And there's no like wrong, you can do whatever you want as far as they're all good. So whichever is more comfortable, whichever you feel like it's easier for you. The belly breathing is something you can do it all the time. Like this is something you can focus on it. So you're breathing, the way you're breathing, it becomes belly breathing. And that comes with practice. The other ones you can do whenever, I mean, there is no, you can do whatever you want. They all are good and they all give you benefits. So it's up to you which one speaks to you more.
Great. Also, Pega is asking, thank you for great presentation. I usually overthink things and I am having a hard time to get rid of the negativity thoughts. How
Okay.
can I stop overthinking? Is there any meditation for that?
Well, Pega, meditation is for this problem. So when you start doing meditation, I bet if you did this 3 minutes, all the thoughts just start chatter bombarding your brain. And that's good because that's how you get rid of it's not like you get rid of the chatter, you make it like slower. It's like you bring the volume down. So, and you're not paying attention to it. So the key is meditation. The chatter is going to become more quiet. And in the beginning, you don't even know it's chatter. You think it's you. But then as you become more experienced in meditation, you kind of separate yourself from the chatter. That's the chatter, that's me. So you observe as the third person your chatter. And that's when the best part to be is to observe it. Once you observe it, you separate yourself from the chatter And eventually, as you do meditation, the chatter is going to become less and less. The volume is going to become less and less. And then when you need to focus on something, you can be very present because you are doing meditation. And that's perfect example of what meditation is good for. That's definitely one of the reasons you do meditation for.
Okay, I have a question from Shilpi. Thank you for the excellent presentation. How do you prevent from going into deep sleep, delta, so that you can access higher brain waves like theta and gamma? Sometimes struggle with this.
Meaning falling asleep.
I guess so. I guess
Yeah,
that's
I mean, when your body, it happens to everyone, it happens to me too. When your body is tired, and sometimes you don't even know your body's tired, you fall asleep. So the best way is not to lay down, just sit up and get more sleep. If your body needs more sleep, get more sleep. But if this happens all the time, your body needs sleep. So it's okay. So because meditation also a way of relaxing your body and mind. So if your body needs it, it's okay. But eventually, if you sit up more and you've practiced more, and if your sleep is, you're not deprived from sleep, you won't go to sleep. But the best way for me is to sit up straight. So because if you lean back, it's the chance of you falling asleep is much higher. And if it happens, don't blame yourself. It just happens for everybody. Even the advanced meditators fall asleep sometimes during meditation. But with practice, things get better. And then you need to probably sleep more. Your body needs to sleep more. Okay.
Thank you, Sepideh, for the wonderful presentation. And I just want to add one little thing. I've been meditating for a while, and everything Sepideh said about feeling good, looking good, vibration-wise, it really, really works. I want to recommend everybody to join the huddle. We are more open to discuss and share in those sessions. And I would like to thank Sepideh and end the meeting.
Thank you, everybody. Thank you for joining us today. I hope I gave you useful information that you can use it at home or wherever you are. And hopefully you have a blessed day or night today.
Thank you.
Bye,
Thank you,
everybody.
everybody.